Hi, I'm Wayne Smith, President and CEO of Delaware Healthcare Association, and welcome to Delaware Health Forward, our quarterly update focused on innovation in healthcare in Delaware. Today, we'll discuss St. Francis Hospital and their focus on the future of healthcare in Delaware with the new Healthy Village model. I'm pleased to be joined today by Lil Schonewolf, Vice President of Community Health and Wellbeing at Trinity Mid-Atlantic. Lil, welcome to Delaware Health Forward.
Thank you. Exciting to tell you all about what's going on.
Well, we are glad to have you to explain that, and we'll jump right into the question. So, St. Francis recently made the exciting announcement that it will undertake a new model of care known as a healthy village. What exactly is a healthy village for those who may not be familiar with the concept?
So the short version is that it's an integration, a continuum of care for an individual, bringing clinical services, what we now are doing at St. Francis and will continue to do, along with social care parts. So if you think about taking care of a person fully, think about that person that might come into the emergency room, dealing with all sorts of social determinants. They'll probably get admitted because they're coming because they don't have a family physician or they need access of some kind to some kind of care. We admit them. We do a great job taking care of them, making sure they're clinically safe. But at the end of their visit, we then say, okay, if you need information on food, getting food, here's someone for you to go to. If you need help with mental services, here's someone else. If you need housing, here's someone else. But we never know what happens to that person once they leave the doors. Does that person actually fulfill those? Do they have even the means or understanding to do it? And then what often happens is we don't close the loop and then they end up back in the emergency room. And it might be a readmission that really doesn't have to happen. What we really need to do is get that person other help. And so this gives us the opportunity to continue to take care of our community of their health needs with the emergency room and all of our other specialty services, but at the same time connect them to those needs right there in the building that they really need to progress. We want to build people in this community to the best that they can be, both in health wise, because really, when we look at the whole individual, healthcare is only 20% of an individual's success. It's the other 80% that we just don't give enough attention to, which we need to if we really want to have successful communities. So having that person be healthy, being able to get food, being able to get educated, be able to get jobs and get housing, not only makes them happier and have happier families, but also better communities and be able to still stay in our community and do well.
I think you gave a really good description there of social determinants of health and the importance of social determinants to the healthy person as a whole being, and certainly what St. Francis is looking for in the Healthy Village model to help you accommodate that and accomplish that. So, and certainly a recognition in our industry in these last years of the importance of social determinants of health. So, thank you for that exposition on what that means, more than just the phrase that we hear bandied about so much in public policy. I understand that partnerships have already been formed with some leading healthcare organizations here and in the region. Can you tell us which organizations are currently part of the Healthy Village and if you expect to continue to grow with additional partnerships in the future?
So I think I should go back what we've been doing for the past year. So when we decided what makes sense for St. Francis in the future, how do we continue to care for this community, especially for those that are most vulnerable in our communities? And how do we make sure that we're not only clinically taking care of them, but giving them the opportunities in all these other areas? And so we did two tracks. Jim Woodward is our president of the region. He started meeting with the clinical team, started looking at the services, reviewing what we're doing in the emergency room, and then building the strategic plan for that so that we will continue all healthcare. And then at the same time, then I started to work with Dynamis Advisors, who's a group that they have done healthy villages throughout the country. The closest one to us is in Milford, Delaware, which is a healthy village. The difference with that one, which is unique to ours, why ours is unique, is because they have a healthy village with all those partners in the building. But St. Francis will be the first healthy village where it'll be in the hospital where we'll have all those services. So in the past year, we did a couple things. We wanted to make sure that we met with all the various partners that are well known and successful in this community for doing good work. And then we wanted to also interview some of our legislators, also interview community folks, and interview longtime colleagues and board members. And so probably did about 60 of those interviews. And it was interesting that the four same topics or four same needs kept coming up, which weren't too different from our community health needs assessment, but the four were senior services that were needed, workforce development, education, mental health and behavioral health services, and housing. And so then we started to identify, okay, so if those are the four topics that 90% of the community, everyone we've asked, who then does it good in this community? Who do we then partner with? So then we had meetings. We've met with and are in conversations with West End Cornerstone. They're very successful with a variety of community programs from birth to seniors. And so there we are working with them primarily in housing, some housing opportunities that we're going to be partnering with them on. We are looking Marquee Services. They will be helping to provide behavioral health and mental health services. So being right there located on the same floor as the emergency room, kind of take that same person that I talked about in the beginning, take them out of the emergency room and go right to those services. They're also looking, could we possibly also provide substance abuse clinic, inpatient and outpatient? Could we also look at what are services that we can then intertwine with our family residents? And then because we have a mobile van St. Clair that does healthcare, they also have mobile services for substance abuse. So then tying in those services. And then education-wise, we had meetings with two local Catholic high schools, as well as Red Clay and some others for high schools, because some of the things that we have to consider is it's great to tell kids to go to college. We really have to focus on getting them to graduate high school. And so that's primary focus for us. And then we can help them to mentor them and maybe going through more. But being able to then also talking to folks like University of Delaware, also had some conversations with Newman, Del Tech. Could we have and provide an education center right inside the walls of St. Francis? And in saying that, we could have classes going on at the same time as we have mentorship programs. So imagine those same high school students being able to get a high school diploma, but at the same time be able to get CNA certification and get a job. We all know that healthcare physicians, we need to fill these spots. We are losing people leaving the healthcare industry. So how to best fill those spots by looking in our own communities, grow our own. And so that will be the education that we'll be able to provide. We have NovaCare, who is interested in more space in the building. We already partnered with Delaware Hospice. Catholic Health Services is looking to do, they're very interested in doing 8 respite beds. Again, another great need in this community. And they have some other programs that we're looking at to be able to do as well. The YWCA, we've had conversation with them for a SANE program for those that sexually attacks. How do we help them? And then just a lot of other conversations with organizations, family counseling, and the LACC. We have a very large Latino community, so it's really important for us to make sure that we are including them in as much conversations as possible so that we continue to see what their needs are. The interesting thing about Healthy Village, too, is as much as we had underutilized space. That's what started this whole conversation. It's a 400-bed hospital. We're having a census of 70s and 75. What do we do with the underutilized space? So some of those units and some of that space is going to be taken up by some of these partners. But at the same time, what we want to do is also have a main street. So imagine
Hmm.
like a mall. Like you come in and then you have set offices with different um, social care connections that we could provide. So it could be someone representing all the various governmental agencies, how to connect them on what they could get. It could be so it could be a number of things all in that same that they don't necessarily need a lot of space, but they
Hmm.
need an office for connections and for us. And we could have it could be a location for food distribution. So it's kind of all these conversations are happening right now.
Well, it's certainly an exciting and commonsensical concept that you've outlined, and I think most people would recognize that in terms of strengthening the continuity of care, right down the hall or two floors up has a lot greater chance of having somebody connect to this needed after acute care services than, hey, here's an appointment slip for across town for 2 weeks from now. So I can certainly see, and I think our viewers will, the very common sense approach and the great advantage this would give to being able to knit a cocoon of care around the whole person beyond the acute care needs, obviously. Well, thank you. That was a great exposition in terms of what is coming potentially and what it looks like in the future. Let me focus on kind of your current and core mission. St. Francis has been a true safety net hospital for Wilmington and northern Newcastle County for more than 90 years now. What change will it be for residents seeking hospital care?
We don't expect that to change. We're still a hospital and we hope to be here another 100 years providing the same kind of care. The only difference is how do we do it better? And then how do we, healthcare is changing. And so you don't, the acuity is different. Everything's different in healthcare. So how do we provide the best care, the best services along with the changing times going into the future. And we just feel that this is the way the future will be for especially for safety net hospitals. And so Trinity, we went through all the approval processes, and Trinity as a whole is a our corporate office, again, 90 some hospitals across the country. This is the first healthy village. So everyone's really excited to see is this the way of the future? Because we feel it is. We feel that this is it truly is where healthcare is going, or it should be.
Well, it's certainly a great and important message, I think, for our viewers. The same terrific St. Francis Hospital, plus the Healthy Village concept. So the acute care bedrock that's been here for so many generations of Delawareans in the northern part of our state will continue, obviously, as a cornerstone for acute care. But then, adding the vision that you talked about and the social the partners to deal with and address some of the social determinants of health issues. So it's a great expansion of your current mission and one I think that has a lot of promise for helping folks in our community. Any final words before we do the sign off?
No, I think that it's an exciting time. I know that, change brings apprehension and people, the trust factor, is it still going to be there? And this is just an opportunity for us to say that we're looking to do a even better job than we've done. We know that one of the things that came up very often in the interviews is the first question was, are you closing? And we were like, no, absolutely not. We're not closing. This is just an opportunity to serve more and serve better. We've met with Christiana too. We've met with, this isn't something we want to do on our own. This is something that's probably going to, we will continue to do this for 10, 20 years, because as the changes in the community happen, as community health needs assessments are done, that's when we have the opportunity to bring in even more partners, re-look at the way we're looking at things. And something else that I think is important is that this is an opportunity for us not to work in silos. This is an opportunity for all of us to come together and have those innovative conversations in the hallway. Like, what do you think if we try this? Having everybody in the building having lunch together, walking down the hallway is an excellent way of doing that. Because I think through COVID, even though it was great that people could work from home, you missed being able to just knock on someone's door and say, I'm thinking about this idea. Who do we need to get together to make this happen? And so that's what we see with Healthy Village. At the same time, we know that telehealth was great. It got us through COVID, and we're thrilled with that. But when people are dealing with social influencers, they may not, that telehealth is not really what makes them, it's not a trusting experience for them. And so being able to have community health workers in the building and guiding them through and doing the connections for them is just going to help them to have access to care and access to social needs and help improve lives.
Well stated. I want to thank you, Lil Schonewolf. It's been very exciting. This is very exciting for St. Francis Hospital and for Delaware. And thank you, Lil, very much for taking the time to share this information with our audience. This is Wayne Smith for Delaware Health Forward. Thank you for your time today in viewing this.
Thank you.